Modifiable risk factors are the factors on which we have control, such as obesity, smoking, high blood pressure, high cholesterol, physical inactivity etc. Non-modifiable risk factors are those on which we don't have control, such as hereditary, age, gender etc. Family history and genetic factors significantly influence the risk of developing premature cardiovascular diseases. Obesity is the primary risk factor associated with elevated triglyceride, low-density lipids, increased blood pressure, and impaired glucose tolerance. Maintaining a normal body mass index, 18.5-24.9, can help in retarding the onset of CAD. The android form of obesity is more harmful than the gynoid form, and abdominal fat is considered more harmful than fat on the hips. High blood pressure is another risk factor, often accompanied by hyperlipidemia, which accelerates the atherosclerotic process by stimulating arterial smooth muscle cell hyperplasia and hypertrophy. Diabetes is associated with tissue damage and cardiomyopathies, and controlling blood glucose levels is important to prevent heart disease. Age is another factor, with atherosclerosis beginning as early as 2 years of age in hypercholesterolemic men. Smoking and tobacco are major independent risk factors for myocardial infarction and cardiac failure, with 80% of smokers experiencing coronary artery disease. Alcohol consumption has a positive relationship with blood pressure levels, so it is best to avoid or take it in moderation. Lack of physical activity is another risk factor associated with sedentary and unexercised lifestyle. Syndrome X is a cluster of conditions such as central abdominal obesity, diabetes, dyslipidemia, hypertension, elevated triglycerides, decreased HDL, and blood sugar abnormalities harmful for cardiovascular disease. Plasma fibrinogen and lipoprotein are genetically inherited markers of early, asymptomatic atherosclerotic plaques in carotid arteries and aorta of hypercholesterolemic individuals. Psychological, social, cultural, and religious factors impact cardiovascular disease risk through food, cigarette, and alcohol consumption. Job stress, lack of physical exercise, and impatience can cause harmful effects on the heart and its vessels.